Gramszlo. Like Erin said, I'm a postdoctoral fellow in the Nemours Cardiac Center. My mentor is Dr. Erica Sood, and I'm excited to talk about a project that I'm planning to submit for a CRRC Internal Fellows Grant here at Nemours. Over the last several years, there's been a growing body of research demonstrating the impact of congenital heart disease on children's neurodevelopment. So we know that children with CHD often have difficulties with fine motor skills, learning, attention, and have higher rates of certain clinical outcomes like ADHD and autism. But only very recently, several studies have identified that children with CHD also experience anxiety disorders at significantly higher rates than the general population. In general, we know that anxiety disorders in childhood do typically persist into adulthood without treatment, and anxiety disorders in CHD specifically have been associated with higher healthcare utilization and mortality risk and lowered quality of life. In other disease populations like inflammatory bowel disease and asthma, we have these really nice disease-specific models of anxiety that have allowed for tailored treatment of anxiety disorders, but no such model exists for CHD yet. So the existing studies that we do have indicate that as the severity of CHD diagnosis increases, the risk of anxiety disorder increases too. So children with complex single ventricle conditions like hypoplastic left heart tend to have really high rates of anxiety disorders, whereas kids with simple ventricle or atrial septal defects tend to have lower risk of anxiety disorders. But nobody has looked at, no one's compared these groups in one study. So the first aim of my project is just to examine the relation between CHD diagnosis and anxiety. Knowing that CHD diagnosis encompasses both the congenital biological differences associated with CHD, but also the environmental context of CHD during the perinatal period, which includes things like early surgical factors and the cardiac care environment itself. The second aim is to begin to investigate how CHD-specific factors relate to anxiety symptoms in children with CHD. And I'm interested in testing two mediators specifically listed here as proximal risk factors. So very broadly, anxiety is a healthy emotional response to perceived threat or uncertainty. But individuals with anxiety disorders tend to overestimate the severity of threat and the likelihood of its occurrence due to both autonomic nervous system dysregulation and executive functioning deficits. Current research suggests that the pathophysiology of CHD itself contributes to depressed heart rate variability, indicating an imbalance in sympathetic and parasympathetic nervous system activation, which we can identify in infancy for children with CHD. And then, as I mentioned earlier, CHD also impacts neurological development, and children with CHD often experience difficulties with controlling their attention, inhibitory control, working memory, which are all aspects of executive function. So this model will test both of those as parallel mediators in the relation between CHD and clinical outcomes. And then I would also hypothesize that the strength of that relationship is moderated by parent mental health, as children with parents who experience anxiety disorders often learn to model those behaviors, and parents of children with CHD very, very commonly experience anxiety and post-traumatic stress. So my goal is to recruit 100 children between the ages of 10 and 18, and as I said, we're hoping to recruit a range of cardiac diagnoses. We plan to collect data regarding cardiac lesion severity, as well as those early environmental factors that I mentioned. And we plan to collect psychophysiological data as well, including heart rate variability and galvanic skin response, both at baseline, during a stressor task, and during a recovery period. Executive functioning will assess through a validated questionnaire that we commonly use for this population and during a cognitive control task. And then parent mental health will measure, again, through a validated questionnaire, and child anxiety we're going to assess both with a structured clinical interview to establish a categorical diagnosis and with parent and self-report questionnaires to establish kind of the level of severity of anxiety or to identify patterns for subclinical anxiety as well. And then we'll plan to test study AIM-2 with a moderated mediational model. So, very briefly, in sum, anxiety disorders are common in children with CHD and have a major impact on quality of life, but we just don't know enough yet about how and why they develop. A disease-specific model of the developmental psychopathology of anxiety disorders is going to help us clarify what treatment for anxiety really should be targeting. And this study specifically will begin to assess the CHD-specific factors that may account for and strengthen the relationship between CHD diagnosis and anxiety disorder diagnosis. Our hope is that eventually the outcomes of this and future studies will inform the creation of an intervention specifically for children with CHD who experience persistent chronic anxiety. And that's it.